What's going on? We're going to be talking about the squat today, in particular these squat variations and how these different squats place different torques and forces on the knee and the hip, and what this could mean for load management throughout a training program. Firstly, what makes these squats even different from one another? It all comes down to the position of the bar and how this changing bar position is accompanied by a changing body position, and how this results in varying forces placed on the knee and the hip. One thing that must remain universal across all of these squats is that the center of gravity must remain over the midfoot. So although they look a little bit differently across each other, they're all equally balanced because the center of gravity remains over that midfoot. To start off, the front squat has the most upright torso position. This is because the bar is in the front rack position in front of the body, and in order to maintain that balance and that center of gravity over the midfoot, the torso has to be upright, but this causes a higher torque placed on the knee. Torque can be loosely defined as the tendency of a force to cause rotation of an object, and it's largely affected by how far that force, or center of gravity in this case, is from that point of rotation. In the case of the squat, that point of rotation is the knee and the hip. The greater the distance between one of those joints and the force, the greater the torque. As you can see in the front squat, the distance between the center of gravity and knee are greater than the distance of the center of gravity and knee in the low bar squat. So it can be said that the torque placed on the knee in the front squat is greater than the torque placed on the knee in the low bar squat. Looking ahead to the high bar squat, the bar is now placed behind the body, around the upper trap area, and this is accompanied by a greater forward leaning posture, and this forward lean is what causes the center of gravity to move further away from the hip compared to the front squat. So the high bar squat has more of a torque placed on the hips than it does on the knees compared to the front squat, because the distance from the knees and the center of gravity isn't as great as the distance from the knees and the center of gravity in the front squat. And as we'll see later, the differing amounts of torques between these squats will have implications on what joint is receiving the most stress, and even what muscles are needed to overcome that stress and that force. Lastly, the low bar squat has the greatest forward leaning posture because the bar is placed further down the back, usually around the rear delts, and this moves the center of gravity even further from the hip, which places a higher torque on the hip in the low bar squat. On the other hand, you can see that the center of gravity is getting closer to the knee. So in the low bar squat, the knee torque isn't as great as something like the high bar squat or the front squat. Given these varying amounts of torques and forces placed on the knee and the hip across these squats, we can consider the musculature involved needed to overcome these torques and these forces. The higher the torque placed on one of the joints, the more the proximal musculature, the muscles closest to that joint, will be involved. Looking at the front squat, there's more torque placed on the knees. This means the muscles closest to the knee, think about the rectus femoris, the VMO, just the general quad involvement in the front squat will be greater compared to these squats. The low bar squat has more torque placed on the hip. This means the muscles closest to the hip, the glutes, the erectors of the lower back, will be involved more so than something like the front squat. Given all this information, we can consider what it means on load management. If someone's going through a knee injury or they're feeling their knees are a little bit worn out, something like the front squat where there's higher torques and compressive forces placed on the knee should probably be avoided, and something like the low bar squat might be implemented, or certain hinging exercises. On the other hand, someone going through a hip injury or they're feeling their hips are a little bit worn out might have to avoid low bar squatting, as there's more torques and compressive forces placed onto the hip compared to something like the front squat or even the goblet squat. All in all, it's not necessary to just pick one of these squat variations and just run with it, but maybe incorporate all of them to better distribute the compressive force and the torques placed on the knee and the hip throughout a training program, and better manage load to prevent injuries and get stronger more consistently.